So from the lecture, this one is not in this lecture, but I would like to put this because compared to the deep angiomyxoma, we should have superficial angiomyxoma, aka cutaneous myxoma. And for this one, less common in genital sites, and then usually small and superficial. We already know from the name, cutaneous and superficial. And then characteristic is even in low power, we know this is not deep angiomyxoma because low power we will see vague lobula divided by fibrous septate. Then this one we can see through myxoid background because we can see blue. And then the vessel is thin wall vessel. You will not see this highlights of vessel wall. And then I highlight here, I think for the exam's purpose, we always want to confirm this diagnosis, finding our friend neutrophil. And then this lesion also entrapped some benign epithelial elements. And then for the staining, it is also different from the deep angiomyxoma. This lesion usually CD34 positive, but ER/PR negative. And we have a syndrome that is Carney complex. That is a PRK-AR1A expression loss. So does anyone remember what is the specific location if we find this cutaneous myxoma and then kind of specific or usually common site for Carney complex? If we see some anatomy sites, there are 3 sites. One is in the nipple, the other one is in the eyelid, and then in the ear. These 3 locations more commonly seen in Carney complex. So let's see low power. As I mentioned, low power, you will know this is not deep angiomyxoma because kind of superficial, it always touch the epidermis. And then we have this vaguely lobular structure, and then separated by this highlights fibrotic septate, and then really hypocellular. Then we can see the small vessel, not hyaline thick wall vessel, this thin wall vessel, and then kind of small. Then we will see neutrophil. Let's see over to slide. So here, low power, we already know we have this lobulated growth, nodule, and then separated by this fibrous septate. Then we can see this kind of like maybe epidermal inclusion cyst-like structure. So it also fit our characteristic. It always entraps some epithelial structure. Then from this low power, we also know that's really hypocellular. So if you would like to call something myxoma or superficial angiomyxoma, you cannot see hypercellular. And then also you could not see tons of blood vessel. If you see one of these 2 features, it's really not a cutaneous myxoma. So then we just zoom in to see this bland-looking spindle cell, but it's not the one I would like to show you here. I would like to show you what is this neutrophil. So as I mentioned, if low power is suspicious for this entity, high power, you want to see neutrophil. It's really characteristic for this entity. So, and then again, the stroma, you can see this is true myxoid small stroma because we can see this bluish. So all the area looks like the same, really hypocellular, and then the vessel wall is really thin. And then everywhere we can find this neutrophil. Another one look quite similar. Multinodular growth separated by this fibrous septate, hypocellular, and also not tons of blood vessel, and then entraps epithelial element, looks like a cyst. And we zoom in to see this bland-looking spindle cell. And then again, we see our neutrophil again. So if you forget all of the stuff about this entity, remember this neutrophil, especially if you are not thinking about it. When you zoom in this hypocellular entity, you find neutrophil. Oh, you're thinking maybe this is cutaneous myxoma. Okay, the last one of this entity. Again, hypocellular, multiple lobule, nodular growth with fibrous septate, hypocellular. And zoom in again to see this thin wall vessel, bland-looking spindle cell. And then we see our neutrophil here. So this is good for cutaneous myxoma.